For placing a ruminal trocar, you want to use similar anatomical landmarks that you would use for your abdominal surgery, which are the caudal border of the last rib, the transverse processes of the lumbar vertebrae. And in a cow that's bloated, there will obviously be a big swelling in the paralumbar fossa here. And quite often you can misjudge where your trocar actually goes and it ends up being quite high. So if you make sure you go a handbreadth or 4 fingers behind the last rib and at least a handbreadth down from the transverse processes, perhaps more if you've got a really distended rumen, and that's the spot, the sort of junction of these two hands is the spot at which you want to put your ruminal trocar. The first step in the procedure is just to apply a little bit of local anaesthetic, so effectively a line block just exactly where you want the trocar to go, and same technique as you would do for a line block or an inverted L block. So needle right into the depths of the muscle and then just fan out and inject as you withdraw. Probably do that over a couple of different sites round about the area that you've identified, and give that a few minutes to work, well, at least 5 minutes if not longer, before you then actually perform the procedure. The first step in the procedure is to do a skin incision. The trocar itself is just going to go through the muscle layers without any surgery, but the skin incision is an important first step. And if you look at your trocar, your skin incision needs to be as wide as the thread of your trocar. So this is probably about 3-4 centimetres. It doesn't really matter which orientation you go in, and for cow skin you have to press quite hard and you want to do quite a bold incision. And you can see, hopefully you can see on the video, I'm not quite through the skin, I'm through the skin in the middle. I can see some muscle under there, so I'm just going to go back in and just widen that skin incision a little bit, and then you can see the muscle actually appearing underneath. Then it's quite a sort of short, sharp movement here to get the trocar in place. Just put the trocar in the middle of your skin incision and you want to stab it in and then twist it around. And as you twist it, the muscle and the rumen should all be incorporated into the thread of the trocar. If you keep the stylet in initially, that keeps the gas in the rumen until you're ready to release it. I'll just show you that now. So just a stab, and then you're going to turn the trocar into the rumen. And it should go right down to the point where the edge of the trocar is pretty much flush with the skin. That's it there. And then if you just release your stylet, you should hear a rush of air when you're in the rumen, which I can hear. I don't know if you'll be able to hear it on the video. What I'd recommend you do is just let the gas out gradually, because there can be a bit of reperfusion going on if you've got a hugely distended rumen full of gas and you suddenly let the gas out. There can be quite a lot of reperfusion injury. So that's it at full pelt, but this isn't a cow that's actually bloated, so it's not too bad. And what you'll find once you let the gas out, you might need to just readjust the trocar and it'll sit a lot better once there's less gas. And if you notice here, there are 2 little holes on the trocar. You can then place some stay sutures through the skin and into the trocar to hold it in place. But you want these to be really loose sutures so that it can adjust to the movement of the rumen. Whether you put this back in or not kind of depends on the case. Initially you probably leave it out, but you might need to put it back in to plug the hole if it's got blocked up with ruminal content. Or if the animal seems to be improving, you might decide to plug the hole and see if the gas reforms. So that's something that you would decide on a case-by-case basis.